What are you doing, sir?
Stretching my hamstrings, they're really tight.
Not like that, son. Have a seat. What's going on, YouTube? It's Dan, it's Ken, it's Dan and Ken PT. Today we're going to be looking at 3 exercises you're probably doing incorrectly.
The first one is the hamstring stretch. A lot of you guys are doing this one at home. You might be doing it wrong. So let's have a look at how Kenny's doing his hamstring stretch right here, and we can correct him. So you see here, you pull the toes up a little bit, not too much. You don't want to put stress on your sciatic nerve. He's leaning forward a lot here. What this can do is put a lot of stress on your lower back. So you're going to stand up a little bit taller. But what you want here is keep your knees straight, tilt your hips forward a little bit, just enough to feel a comfortable stretch in the back of your leg. You want to hold that for 30 seconds.
Now, Dan, when do I do this? Like before a run, after a run?
I would recommend stretching after a run.
Okay. Now, why am I doing this? Why should I even do this?
Stretching is going to improve blood flow, it's going to prevent injury, and it's going to improve your mobility.
Thanks, Dan. Okay, guys, the second exercise we're going to look at is called the scapular retraction. So you have 2 scapula, your right and your left, aka your shoulder blades. So an important exercise that you should do for posture and scapular mobility is a scap retraction. So go ahead and squeeze your shoulder blades together, Dan. Good, good. Now some of the things I see incorrectly are the patient will shrug their shoulder blades up. Now there's nothing wrong with a shoulder shrug, but not during this exercise. So what I'm actually going to have Dan do is 3 steps. All right, Dan, so I want you to elevate your shoulders up, then down, then back. What this does is it allows Dan to understand the difference between the 2 motions. Okay, up, down, retract. Good. Up, down, retract. Perfect, Dan. Guys, I want to touch on another angle. So before we got the frontal plane, now we're going to look at the sagittal plane. So here's Dan. He's doing his scap retractions, right? That's pretty good. So another common mistake I see is a lot of patients are in an anterior pelvic tilt. He's kind of compensating with his lower back when he squeezes. What I want him to do actually is posterior tilt a little bit. That does, it fires the core and it takes your lower back out of the equation. So Dan, I want you to keep this tilted posteriorly or backwards and squeeze the shoulder blades. Good. And squeeze. Yep, keeping that tension on his abdominals. Good. Perfect, perfect. The third exercise we're going to do is called a transverse abdominus contraction. The transverse abdominus is a deep abdominal muscle responsible for stabilizing your lower back or lumbar spine. So one of the things I see people do is they squeeze their whole stomach. They squeeze almost like a mini sit-up, which is okay. There's nothing wrong with that. But we want to engage that deep transverse abdominus muscle. Now, to do that, we want to focus on 2 things. 1, the breath. Breathe in through your nose, out through the mouth. In through the nose, out through the mouth. Now, there are 2 bones here. One right here, one right here. They're part of your pelvic bones, okay? And now when you breathe out, I want you to think of those bones coming together like a suction. So breathe in through your nose, out through the mouth. Again, if you feel a nice suction feeling here, you're doing it correctly. In through the nose, out through the mouth. In through the nose, out through the mouth. Perfect.
All right, let's recap what we went over today. So first we went over the hamstring stretch. So remember, stretching is important to do after exercise. It's going to help you with mobility, blood flow, and preventing injury. And you want to do this throughout the day. Hold it for 30 seconds. Make sure you do it every time after you exercise.
The other exercise we looked at was the scapular retraction, right? Great for posture and scapular mobility. Now you want to do that anywhere from 10 to 20 reps, maybe 3 sets. And you can do that throughout the day, every other day. It's kind of up to you. Just make sure you're tilting that pelvis backwards and preventing those shoulders from coming up. And the last exercise was the TRA contraction, or the transverse abdominus contraction. Remember, you want to breathe in through the nose, out through the mouth, thinking of those two bones coming together as you breathe out. That's great for lumbar stability and preventing any back pain when you're performing your daily activities. Guys, thanks for watching the video once again. Please give a big thumbs up and subscribe down below. Our next video will be coming pretty soon. If you have any questions or suggestions for future videos, please email us at danandkenpt@gmail.com. And remember,
Live
laugh,
and love.